Hey guys.
No, you're not at the pool right now. That ain't fair.
Oh my God, I am so jealous right now.
What's up, Tom? What's
What's up,
up,
Brady?
Looking good, man.
Hey, you
Oh,
too.
man.
Lindsey,
All
I'm
right.
so jealous of you
That's
right
not
now.
fair. That's definitely not fair. Well, hope everybody's, that's not true.
Oh my
It's really
God.
Oh, man. Hope everybody's doing good. Huge step for those of you that have huge step that most of you have, not all of you have passed steps. So that's awesome. You're moving on to bigger and better things. I promise you, this hospital life, though it is busy and a bit stressful, it's so much better than basic science. It's like you're actually doing things, like relevant things. Though nothing's black and white anymore.
No.
Type 2,
No,
let me tell you, type 2 diabetics go into DKA all the time. So that's not true. People with COPD, beta blockers are contraindicated. They're all on it because they're in heart failure. They use the same antibiotics, the same 5 antibiotics for everything.
Yeah.
Though you won't know what they are
True.
because they use commercial names for them.
Yeah. Oh my God.
So
the combinations too, because all of those different combinations for specific drugs, like we learned all of the individual ones and like this covers this covers this. It's all in different combinations that they use all the time, and they use it's all very standard.
yeah, so steep learning curve, but you actually get to interact with patients. So
They don't expect you to know anything though.
No, you're definitely
They do not expect anything of you.
Yeah,
it was funny, my first week we were rounding with the attending and he was very chill. He a very good attending for students just starting out, and he was asking us questions. And he stops and he goes, wait, what week is this for you? And he's like, this is our very first week of rotation. He's like, oh, okay. So I'll be nice to you.
Yeah. You'll have some that'll pimp you, but for the most part, like everybody's pretty chill. So since we're recording this, so people can watch later, hold the questions till the end so that we can answer them verbally, so that people that watch the recording, they're going to have similar questions. So hold the questions. We'll do that at the end. When me and Lindsey are going to kind of run through what we've been through so far, and kind of we know what kind of questions you guys have. So we'll try to address these things that are common. So Lindsey, go ahead. The floor is yours.
So, hey guys. So I'm currently rotating at Brooklyn Hospital Center in New York. I wanted to be in New York. I'm very happy with where I am. So kind of starting from the very beginning of my experience, everyone's experience is going to be different from where they're rotating, the rotation they're rotating through. But kind of as a convention, what I was told is once you get your schedule, wait for the clinical director at that site to reach out to you. I was told by multiple people it's inappropriate for you to reach out. I do know people who did reach out personally once they got their assignment, but in my experience, just wait a little bit to see if they reach out. If you get like to a week out and you haven't heard anything, then yeah, I would reach out because I would be freaking out. But I was told by multiple people just to wait. And so you have a single clinical student director at each site, but for each rotation, you have an individual person for that too. And so they're the person, well, at least at my hospital, they're the person that sends you your schedule. Now, I started out and I didn't get anything until 8 p.m. the night before I was supposed to start. So for those of you that are sitting there, maybe you're starting, you haven't heard anything, just sit tight. They're going to email you, but it might not be really early. So he emailed us this long syllabus of expectations. It was very organized. It was everything we needed was in there. But it was the night before and we were showing up the next morning and it was just kind of, hey guys, here you go, kind of pushing us into clinicals. Oh, backing up. I didn't have anything orientation wise. I have friends who did have to do a bunch of requirements, for example, the N95, a drug screen, all of these different things. I did not have to do that. We literally, I sent her a picture, I sent her a headshot for my ID. I showed up, I was handed my ID, and she gave us a quick tour of the hospital and was like, okay, go to your orientation for your rotation. So it happened very quickly. It was kind of a whirlwind. There wasn't a whole lot of step A, step B, step C, like all of this. It's really just we kind of figured it out on our own as we went. But my first rotation, so I'm done with pediatrics. I'm now in family medicine. My experience, we work with the residents a lot. My roommate, Madison, you guys know Madison. Madison, her first rotation, they worked with the attendings. And so kind of depending where you are, your immediate person that you answer to might be different. You might report to the attending, you might report to the intern, you might report to the residents. And so it really depends. We report to the interns and the residents. And so they kind of showed us the ropes. Other fourth year medical students, we have a lot of medical students around. So there was a fourth year SGU student rotating who kind of showed us the ropes a little bit. But listen to the residents, listen to the interns. They are very aware of where you are. They don't expect a whole lot from you. They, in my experience, they're very just attuned to you're figuring it out. They don't expect you to know anything, like procedure wise, hospital wise, patient care wise, presentation wise. They don't expect you to know anything, especially if you're like, this is my first rotation. They're like, oh, okay, I'm going to walk you through it. So don't feel like I'm going in there with no experience at all. I'm going to make a fool of myself. You're not, because everybody's in the same boat. But just watch and observe, because you'll be surprised at how fast you pick everything up just by observing what the residents are doing, how they talk to each other, how they talk to the patients, how they talk to the nurses, the attendings, everybody. So just be very observant of that, and make sure that you are asking to do stuff. If you sit back and you don't ask to do stuff, you're not going to do anything. But if you assert yourself and say, hey, I really want to learn this, or you ask questions like, hey, what was this with this patient? They're going to teach you. They're going to walk you through things. So don't hesitate to ask questions. Don't hesitate to say, I really want to learn how to do this. I want to do this, and they'll do it. Like we both in peds and now in FM, I expressed that I really wanted to draw blood and place IVs, and so they pooled supplies. We went off into a little corner and they taught us how to do it, and we were practicing on each other. I think you guys got the opportunity to do a lot of that on the island, which I'm very jealous that you guys got to go back and actually do hands-on stuff. But it's just an example of, if you assert yourself, if you tell the resident that you really want to do stuff, they'll pull you aside. They like teaching. They like having students that want to be there. They like having students that take the initiative and say, look, I want to be here. I want to be involved. I want to do stuff. And they love it. They absolutely love it. Study wise, it's exhausting. I will tell you that. You're there early in the morning, and then we were there early in the morning, and then you get released kind of when they decide to release you. You'll have like a set schedule, but your end time of the day is always just when they release you. So I've been released at noon, I've been released at 2, 3, I've been released at 6, 7. So it's hard to gauge day to day when you're actually going to be let go. You're going to hear a lot of people say, oh, stay after, be that person that's always there. Yes and no. If there's a cool case that you want to get on that is just coming in, yeah, say, I'd really love to observe this case. But if there's nothing going on, leave. Just don't sit around simply to sit around, to study, to do stuff, because they want to go home too. And you need that time to rest. You need that time to study. It's difficult to come home at the end of the day when you've been on the floor and you have to be on and study. So if you have the opportunity to go home early and there's nothing going on, take it. Just take it. Don't feel like you have to sit around and show your face to make a good impression. That's not true. Because half the time we're in the library anyways, and the residents aren't even there. And so they don't even know you're there anyways. They just text you if they need anything from you. Shelf exam wise, I posted a big thing on my page. UWorld is the single, and we all know this, UWorld is the single biggest thing that people cite as their success. They're like, yeah, just keep doing UWorld, just repeat your incorrects, take multiple passes through. And I really did feel like the content in UWorld was very representative of shelf, what I saw on the pediatric shelf, at least. And I passed it, very happy. So yeah, and then those high yield videos. What I have heard from a lot of people is not to use review books very much.
Clinicals.
Say that again. You can type it in the chat too. I couldn't understand you. I'm sorry. But yeah, those high yield review videos. And then a lot of people will say that for this rotation, this book is good. For this rotation, this book is good. I, in my ignorance, went and just bought all of the first aids for all of the rotations and everything. And I have not opened it up once. But a friend of mine who's now in residency sent me a list of what she used to honor all of the shelves, and I'll post that too. But there are only 2 rotations. One rotation. She said psych was really good using first aid, but the rest of them were other things. So don't do what I did. Don't go spend $500 on all of those review books, because for shelves and for step 2, everyone says it's essentially just UWorld. You just do it over and over and over again. That's all I can think of right now. Brady, you want to go through your experience so far?
Sure. Did y'all get an email from Dr. Magnifico yet? Somebody?
Oh, that long email, yeah.
Yeah, y'all should have gotten that. If not, you will be getting it soon. Anybody? Yes? Okay, good. So that's going to kind of outline, and it's very dense. It's going to outline what the expectations are typically. Like Lindsey stated, it does vary a little bit from hospital to hospital, but SGU does put in guidelines for everybody. So for example, we have to use Firecracker. I don't know if y'all are familiar with it. It's not the best compared to UWorld. I don't like the explanations compared to UWorld questions, but we have weekly quizzes that are required. Did you have those? Do you have those for PEDS too?
Yeah,
Lindsey?
it's all of them.
Okay. So yeah, you'll have to do weekly quizzes. Whatever, just do them and get them done. But for the most part, like all I'm doing right now is UWorld questions basically. But we'll get to that. So contrary to what Lindsey said, we were bombarded with emails, had a lot of stuff to do for orientation. We had to submit a background check, a drug screen, the whole 9. We had to go in and get the N95 mass fit test, but they emailed us a bunch of times to make sure we got it all done. So again, it's going to vary from hospital to hospital as to what they're going to require from you. Ideally, you won't have to wait like Lindsey did until the day before to deal with the stuff, because we had to go get our badges like a week before everything. So that was that. But yeah, look out for the email there. They may want you to, even though your start date is whenever, they may want you to come in a few days prior to get your, we'll get, so you can get like your badge and everything. They emailed us early on. Again, I'm at St. Joe's. I know a lot of y'all are over in Hackensack too. I don't know how Hackensack is running everything, but it should be a couple of weeks before. If not, maybe it's like Lindsey's situation. Y'all are going to do the orientation in-house when you get there. So that's for that. I know it's kind of a pain. I don't really know what to say other than if you don't get the email, then I assume you can just show up and be ready to go whenever orientation. They should at least tell you when to be there for orientation. But so I have not taken a shelf yet. 2 of your rotations are going to be 12-week rotations, the IM rotation and the surgery rotation. I'm about 9 weeks into IM. So my shelf is in like 2.5 weeks. So like I said, I'm basically just doing new world questions right now. The stuff Lindsey did post is really good. It kind of outlines things. I may end up watching Emma Holiday's video. Yeah, so but for the most part, like it's kind of like Steph, like the best way to cover a lot of material quickly is to do questions, right? And I'll be completely honest with you guys, like this is all new material. Like it's not going to be like, what's the diagnosis? It's going to be like, well, what do you do first, right? Like they give you a situation, patient's coding, what are you going to do first? Do you get them the CT? Do you get, do you do lumbar puncture? Do you give them beta blocker? And it's like, well, you're going to do everything, but what do you do first, right? So I get a lot of the U world questions wrong, but it is more of a learning experience, right? After you read the explanation, you're kind of like, okay, I get it, right? I see what you're saying, like why you did that. But you need to get through the questions, and maybe if you have time, do the incorrects too. That's just it's kind of a learning process because we don't have 2 years of lectures to go off of. We're kind of just expanding on things, but it is new material and it is frustrating at first. You're going to want to do that. So my first 4 weeks were on the floors. So we worked pretty long shifts. Like every fourth day we had to work a long call where we had all the codes in the hospital. So we were on rapid calls. So it was long hours. And because it was early on, I wasn't studying as much. I was more like, let me stay in the hospital. Let me try to get a rec letter from, whoever. Let me try to, try to excel in the hospital so that I made a good impression. Now, if I'm not gone by noon, I'm kind of upset because I want to go home and study, right? So it's kind of like Lindsey said, you do want to exert yourself and kind of speak up. You want to ask questions. They do want to teach. The residents do care. But if you're going to sit there and not say anything, then they're not going to talk to you. Like they were just in your position. They know how it is. But you need to just ask questions. Be like, how do you do this? Why'd you do that? What are you going to do about that? They like talking. We're all in medicine for a reason. Like everybody likes discussing it. So just be part of the team. A lot of times you're going to have to do busy work, like go fax papers for them or whatever. It's just part of it. Like we're the bottom of the totem pole. Like just do it. I had my own patients. Like I went and saw them in the morning before I saw the resident, and then I went with them to see the resident. That way I was prepared to present in rounds. I did all my own presentations. I presented in the ICU, even though a lot of people don't want to do that. I made mistakes. I made plenty of mistakes, but at least I want to make an impact. I want to to the doctors, right? I want them to at least remember me, or like I have a mask on, at least remember the top of my forehead at least. But you need to speak up. Like it just is what it is. You need to try to. It's better that you try and mess up than stand in the back and not do anything. So my first 4 weeks was on floors. I did ICU for 2 weeks. I did a week on POEM, a week on GI, so saw some procedures. Now I'm doing like clinic stuff, room clinic, derm clinic. So it's it kind of worked out for me because now I can study more. It's kind of a little bit more laid back. But it's going to be important that you kind of put yourself out there. You're going to have to touch patients. I don't know if y'all realize that or not, but you actually do. You have to do it. And just go talk to them. Like sometimes they'll even ask for you because you're their advocate at times, because you're the one that that took the time to talk with them. That's kind of how it's gone for me. I wish I had advice on shelf, but like I said, I haven't taken it yet. We'll see how it goes. I'm moving on to surgery next. That's another 12-week stint. So we'll see how it goes there. Like I said, okay, so in regards to books, there's like Step Up to Medicine, but it's a little bit outdated. I don't use it. I think I have the digital copy somewhere. Other than that, there's the Step 2 First Aid. I haven't really looked at that either. I'm literally just doing New World questions. I kind of agree with Lindsey. Like, I don't know if there's a lot of time to sit there and read books, but because you're going to be tired when you get home. I think one of the biggest things is, we've all learned how to study hard, but studying efficiently. Like you're going to have a checklist of a million things to do, and you just need to prioritize what you do. And what it's going to come down to is you're sitting down and doing questions. Like the IM, the shelf questions, there's 1,200 questions. So if you break that down, it's 100 a week, which isn't a big deal over the 12-week period, but it's probably better you save those questions till the last 8 weeks, I would say. That's what I did. So the first 4 weeks I was stayed in the hospital. I wasn't studying too much. The last 8 weeks, I really started doing questions, because if you do a lot of questions 3 months beforehand, that's, you'll probably forget them, unless you plan on doing your incorrects. If you do that, then you could start early. The way St. Joe's has it set up, again, it's different from hospital to hospital, but we kind of do a subject a week. So like of the 12 weeks, we did like a cardio week, a poem week, endocrine, room, the whole thing. So we kind of are covering it. We do have afternoon lectures, Mondays and Wednesdays, which are pretty much till 4 in the afternoon. So 1 to 4.
And those lectures, they're not like SGU lectures with slides and you sit down. These are lectures that the attendings do, that the residents do. It's like case presentation. Well, for us, it was like case presentations, or, in peds, it was different specific peds topics, but it's not like step-based. It's not shelf-based. It's very clinically based lectures. So it's not what, lecture hall kind of thing.
They're actually much better. Like, they come in and they're like, the patient's blood pressure is 220 over 150. Like, what are you going to do?
Yeah,
Right?
and for us,
like,
it was very collaborative too. You talk back and forth like, hey, this is their chief complaint. What do you do next, kind of thing.
Yeah, exactly. So you'll be surprised how much you actually learn while you're at the hospital, that like questions come up in UWorld, like so many people have COPD, and like so many people take too much NSAIDs on a daily basis. You'd be surprised. They're in renal failure now because of it. These questions come up in UWorld all the time. You'll see crazy cases. I saw some guy in the ICU had babesiosis, which is like super rare. Like it's like a malaria based. It's very similar to malaria. So you'll see some crazy stuff, and it'll help you on your UWorld questions. Yeah, you're going to learn a lot. The lectures are actually, like I said, they're good because they're clinical based lectures. Let's see what else. A lot of people, even if you haven't used Anki in the past, I'm still stubborn and don't use it, but a lot of people like it for clinicals. Again, because you don't have a basis of knowledge. So unless you're using the UWorld questions as a learning tool, then Ankis are really good. At least my friends have said that it is a good representation, because it's kind of weird. You're like, what do you do next? Like I'm going to do I'm going to do A through E, but what's most important? And it's not exactly intuitive until you start going through the questions and going through the cards. Yeah, long hours. So again, like learning how to study efficiently is the big thing. Try to put together a schedule, but your schedule is going to change weekly. Some days you're going to think you're going to get home at 2 and you get home at 7, and you're just like, that ruined everything. So sometimes
some days
you're going to
get a random day off. Yeah, you never know.
Yeah, you take advantage of that. Sometimes you're going to have to work weekends. I mean, it is what it is. You're on call shifts too. I haven't done surgery yet. Like I said, that's next. But some of the students that are doing surgery right now, I mean, they're there at like 4:30 in the morning to like 4:30, 4 in the afternoon, and then they're expected to go study. They don't let them study while they're at the hospital most of the time. So it's really touch and go. You really have to be efficient. Like even if it's like you have 30 minutes for lunch, like you can do a couple of questions while you eat. I know it's aggravating to think like that, but you're going to get home and you're going to be super tired. So that's good. So Anki, that would be good. What else?
I personally, I watched, this is backwards, but it's just how my brain works. I watched those high yield YouTube videos. I made a review from it, and then I was doing questions, and I went through it systems based once, and then I was repeating the incorrects and repeating the incorrects and repeating the incorrects. And while I was doing that, in the review I had made from the high yield videos, I was kind of altering it, annotating it, condensing it down, like, okay, this is what this means, this is what this means. And if I didn't understand something, I would look it up. And that really helped me. And I felt like that was very representative for pediatrics, for the content that was on the shelf exam. But that's how I studied, and I did fine. So it really is just getting through the questions, honestly.
And then another thing that, because it's not just like you're going to go home and you just have all your time to do questions. At least at St. Joe's, we have work to do too. Like we have to write patient reports on our patients. Some doctors like they're really exhaustive, like 15-page reports, which are just obnoxious. Other doctors, you could just turn in a 3-page like summary and it's not a big deal. So there's busy work here. We have to be ready to present for cases. So we all assign ourselves topics for cases for lectures. They'll call on you and you just really need to be prepared. So one thing Lindsey said I wanted to reiterate. So you're gonna have a mentor, one of the doctors who works for the hospital, but technically also works for SGU, who will stay with you through the year. Okay, so they'll help you schedule your 4th-year rotations. They'll help you making sure you're like ready for shelf. They'll kind of like make sure you're mentally stable. Everything is good to go. But for each of the rotations, you're also going to have one of the attendings in charge of the rotation. So I have a mentor, but I also have an IM rotation director, student director. So we kind of report to both of them. But specifically for IM, he's rough on us and he likes, it's the point is like, you should finish the IM rotation and be able to write a good patient note, right? So it's not just like your soap notes you're typing up for the OSCE, like, you know, you can't just write whatever you want. Like he's going to call you in and be like, why are you doing this? And, you know, for the plan assessment and plan and stuff. So you kind of have to get your bearings, but that's a good thing. That's kind of the idea. Let's see, what else? Hopefully y'all are planning on living fairly close. I don't know how many people have gotten their living arrangements. You know, hopefully 20 to 30 minutes max, because it's rough the timing's rough, trying to get to and from places and having enough time to study. I do know people that commute, hats off to them. But you know, like the less time you have to be doing other stuff, the more time you can focus on what you need to focus on. Because at the end of the day, like, it doesn't matter if you stayed for 10 extra hours one day doing procedures. Like if you fail the shelf, nobody cares. Okay, yeah. So take that seriously. I know all of us are enthusiastic about this, but like, number one goal is passing the shelf. Yes. They did raise the grades for the shelf. For IM, you have to get a 78% to honor the shelf. I think a 63 is passing, a 78% scaled is honors, which is easier said than done. But I think people have been doing really well in psych, so they bumped up the passing score for psych to like a 75, I think.
Yeah, it's high. It's high.
So I think surgery and IM both are 78% to honor, and everything else is like 80 or something like that. You have to honor the shelf to honor the course. Okay, which is okay. So even if you get a high pass on shelf and you get excellent scores on your professionalism and all that stuff, you still don't get it. You have to honor the shelf, period. Because everybody, all of us will all get nice for the most part, patient interaction and working well with the residents, and that's easy. But so take that seriously. Honoring the shelf or passing the shelf is going to be your main goal for sure. But for these 12-week for surgery and IM, hopefully if y'all are starting in that, all four, you can just learn the hospital, learn the ropes for the first few weeks, and then kind of go into studying within the last 8 weeks. They say for you guys in surgery that about half of the surgery shelf is IM, because there's post-op kind of IM complications that go along with everything. So you have to know that. For those of you that are starting IM, I think I had the best situation. Started IM on the floors, learned IM, and then I'm moving into surgery. It's more challenging in time constraints, but at least I kind of have my bearings from IM. Those of you that are jumping directly into surgery, start waking up early, I guess, because it's crazy early. Yeah, I go to bed before the sun goes down now, so I'm like, it's no good. Let's see, what else? I guess we can open it up to questions if you guys had anything y'all wanted to ask specifically.
Oh, I wanted to say something. Brady, you said something that jogged my memory. You are on the patient care team. If you go talk to that patient, you're that patient advocate too. So make sure that you are communicating with the residents, you're communicating with the attendings. And if the patient says something to you that they want relayed, make sure you relay it. Like, you are the patient advocate. And when you do rounds, they will see you as, oh, this is the person I talked to. This is the person that, took my information down. And a patient called me out on rounds yesterday, is like, hey, I talked to you about this. And I said, yes, we talked about this. And this is what we spoke about with the residents. And so make sure that you, we all do it, but just reiterating, the patients will see you as on their patient care team, and they will look to you for comfort. They will look to you for guidance. They'll look to you for, just being there. You're on their team. So just make sure that you're always communicating, you're always listening to the patients, and don't let stuff slide, because will be embarrassing. Because the patient was like, he pointed to me, I was standing right there. He's like, I talked to you about this, and everybody's saying there, all of the students, the attending, the residents. I was like, oh my God, my heart started pounding a little bit, but I was like, no, Lindsey, calm down. You know what he's talking about. You talk to this patient about this, you're fine. But just understand that you're being looked at by so many people.
And keep this in mind, like, you should, in your mind, you should think, I want to make the residents' job easier. Like,
Yes.
because they could make your life good and easy, or they could make it hard on you. Okay. So like, if you're a team player and you're like, yo, can I help? Can I go do something? Do you want me to go see that patient? Do you want me to drop off scripts? They're more likely to include you. They're also more likely to be willing to let you go early, if that's the case. It's one of those things you really have to feel it out. Like, you don't want to ask to leave early, but you don't want to just be sitting there, like, so like, you just have to just feel out the situation, right? Like, if everybody's just sitting around, maybe you could be like, hey, is it okay if I go sit in the library? Something like that. But if people are busy, like, just back off and wait a little while. Let's see, research opportunity. So we had an interesting case. It was like a 47-year-old with metastatic choriocarcinoma, a man, which is unheard of. And so the residents decided they wanted to do a case report on it. So I'm going to try to jump on that as a case presentation. But yeah, so whenever something crazy happens and some crazy diagnosis happens, typically the residents are going to want to jump on it. The best way to do it is say, hey, read that case. Yeah, is it okay? I'm willing to do the legwork if y'all want to do it. So you can jump on case presentations, research, stuff like that. So there are opportunities. You have to be proactive about it for sure.
Yeah, I've gotten the same opportunities for multiple case reports. Just talk to the resident, or even if they don't already have it, say, hey, this case was really interesting. I'd really love to do a case report. And they'll probably jump on it with you. So don't hesitate to ask. Really do not hesitate to ask your residents for things.
Yeah, just tell them you'll do the busy work, and they'll be more than happy to put their name on the thing, right? And then you can always ask them to do it. But yeah, so look out for those opportunities, depending where you are. The floors on IM, depending on what hospital. Like, St. Joe's is in Patterson, so it's a level 2 trauma center, but it's like an inner city hospital. So we see some crazy stuff. So random Babesia, it's just crazy. We see all kind of crazy stuff. Let's see, color scrubs. No, my hospital doesn't matter. It doesn't care, except in surgery. You have to wear surgical scrubs. Actually, and we're supposed to wear dress up for clinic, but I wear scrubs every day and nobody's told me anything. So I was just going to wait till somebody tells me that I have to wear a tie, because I just wear scrubs every day. It is what it is. So yeah, you could just show up. If the hospital may be different and tell you you have to wear the hospital scrubs, but unless you're in surgery, you kind of just show up as long as you have your short coat on. Actually, I don't even wear my coat anymore. I just wear a jacket. I pretend I'm a resident.
Some clinics, they'll want you to wear your white coat in the clinic. At our hospital, some people showed up to OB-GYN clinic without the white coat, and they were called out on that. So just make sure you know what the expectations are. I haven't worn my white coat once. I always wear scrubs every day. But some will require you to dress up, some will require the white coat. So just make sure you know those expectations, because you might get yelled at, you might get called out on it. So
yeah, leave it in your car or whatever. But clinic, they like to, you need to dress up for clinic. But if you're on the floors, Like, I don't want COVID on my tie or anything like that. So just wear scrubs, who cares? Unless they tell you differently. Okay. At days a week. Okay, so we're limited. At least in IM, they tell us we're maxed out at 50 hours. We're not allowed to stay past 50 hours. Now, take it or leave it. It is what it is. I don't even come close to that. On floors, I did on floors, but now that I'm in the clinic and stuff like that, like I don't even come close to that. But in surgery, I think they go well over it, and they're supposed to be capped at 50. They go over 50. They're like 60, 70 hours, and you can't say anything about it. Like, no one actually cares about the 50 hour limit for surgery. But again, that's at St. Joe's. It is what it is. But apparently they're having it a lot worse than we are in IM.
So how long does it take to tackle all of the requirements? This was something that I was actually very stressed out about going in, because reading Magnifico's long emails, like, how am I going to be able to do this? It actually doesn't take that long. Not gonna lie. The firecracker quizzes, you have one a week. They release it to you on Friday, and you have until Monday at noon to get that in. It's 25 questions. You have about 30 minutes. Make sure you're actually doing it, because I have heard of people who click through it too quickly, like they're just trying to get it done,
Yeah,
and
no.
they get an email saying, oh, we noticed that, you didn't do this or something. So you have to do it. You have to actually do it. So don't blow through it. They will know. The PEL, go for it.
Sorry, it doesn't matter if you do well on it, but you
No.
can't answer these questions in 2 seconds and know you click through it. It flags in the system. All right. So I don't do well on any of these. These questions are ridiculously hard, but I at least look at them. So you do need to be aware of that. Sorry, Lindsey, go ahead.
No, you're good. And then the PEL, that doesn't take very long. Actually, you put in the complaint, the primary diagnosis. If there was a secondary diagnosis, you can put that in. You put like how involved you were in the case, but that's really it. What they're wanting to do is make sure that you get everything. You see enough things, but then if you don't see something, they have videos that you can go watch. And then you just do the PEL and you say it was a virtual encounter. And so it's super simple, but then you have to upload your direct observations. The direct observations, again, they know, you'll go up to the resident meekly. It's like, hey, can you please? And they're like, oh yeah, whatever. And so the residents are really great. In my experience, the residents have all been fantastic. They know exactly what you went through. They know or what you're going through. They know the requirements, and they are more than happy to help you fulfill them. A lot of them are from SGU. Most of the residents that I've encountered are from SGU. And so
yeah, same here. Same here. A lot of people at SG at St. Joe's are from SGU too. Let's break this down real quick though. So yeah, firecracker quizzes are going to be weekly. They have like flashcards too you're supposed to do. Take it or leave it. I don't know. I just clicked through them. I'll show you all the PELs real quick. This is what I have. So this is kind of what it looks like. You do, so you'll get a link to this. So you click the medicine rotation. I've done 20 of the 24 encounters. So it tells these are the 4. I just haven't logged these yet. These are the 4 I have left. These are the ones I've done already. So you kind of just create a log, like, well, whatever. You create a log like that, and then you log everything in. But for example, say situation like you can log like a patient has diabetes, hyperlipidemia, kidney injury, kidney disease, whatever. You can log that as multiple logs because that's one of their complaints. But you also can log things that are not. You're supposed to log a lot. These were mostly from the floors when I saw the patients more interactively. But so you want to you have to get through these 24 requirements. But I don't know. I probably have like more like 40 or 50 actually logged that just worked, that didn't fall into their requirements, right? Like pre-op type stuff. So of the 24, I just have to log these 4 left. Technically, what they used to say is you could use iHuman, but we complained so much that iHuman was the worst thing ever invented that they got rid of it. So y'all can thank us for that. No one ever has to do iHuman again. So yeah, so that's that. The observerships, yeah, like just once you get cool with one of the residents, like I didn't even, the resident filled it out for me, put it that way, and it got glowing. Yeah, so it's fine. They'll fill it out for you, they don't care. I think, oh, the other thing is like for IM, there's 1,200 questions in the U World. You're required to do at least 600 of them. I don't know anybody that is not planning on finishing all of them though. So that's good there. So I think that's so for your day-to-day things, the firecracker, the PELs, the observership things, you have to write patient reports and stuff like that. So yeah, that's pretty much it. It just seems like a lot at once, but once you start doing the day-to-day thing, my advice would be to like do your patient logs daily. It's just like 2 or 3, it takes 5 minutes. That way at the end of the week, you're not like looking up medical record numbers and like MRNs and like trying to figure out what patient was what and all that. There's no way of them technically checking because you don't actually put patient information. That's against HIPAA. So you're basically putting, I saw a patient who had a stroke. That was a chief complaint was coming with syncope, whatever. And you just kind of put a little thing and then you could check that box. So yeah, that's going to be like your day-to-day stuff, and you'll be seeing patients. Like I said, be proactive, ask to present during rounds. It's better to mess up than to just stand in the back and do nothing.
Oh yeah, and they're really not going to call you out if you mess up. They're just gonna, like, sometimes the attending might get a little short and say, no, this is all I want, but it's not personal. Just take it as a learning experience and move on. The residents will most likely say, hey, that was a good job, or tell you how to fix it. So yeah, really just the best thing to do is try it, and nobody's gonna fault you. Really, nobody is going to fault you if you mess something up or you don't say it the correct way. And everybody is really, in our experience, everybody has been very accommodating and very nice.
And so see how the residents present during rounds too, because I've had attendings that like they see so many patients that the next day they have no idea what's going on. So you need to be like 57-year-old pancreatitis, showed up 2 days ago, hypoglycemic, whatever. They need that. But other attendings I work with, like they just want you an overnight update. Like, did they eat? Did they go to the bathroom? Are they good? Are they febrile? Whatever. So you just feel it out because you see how the residents present, because it's kind of like it becomes intuitive. Your goal is to blend in with the residents as much as you can during rounds, right? Like as much as you can. But again, like it's easier said than done. But that's the idea. Try to fit in. Yeah. Okay, absences. Okay, that depends on the hospital.
Yeah.
I know a guy in surgery that got COVID for a week, and he has to show up every weekend until he makes it up, which is not fun. I know I'm rotating with another guy, with a guy in IM that got COVID, and they're not making him do anything. So it really depends on the situation. Yeah. I think like you just need to be upfront. Like if you say it's like you have to go to a wedding or something. They'll just be like, well, make up that Friday, the following Saturday. The problem comes in when you miss, like, I think if you get COVID, you're required to stay out 10 days, even though CDC says 5, hospital requirements are 10. So yeah, I mean, you miss 10 days. I mean, yeah, that's a big deal, but it really depends. You just have to be upfront with the attendings. They kind of understand it. It's a lot to ask for you to come in every weekend. After that. So it just really depends on the situation. Okay, so in regards to being placement in term 5, I took step early, assuming I'd get my first choice. I got my second choice. It was a blessing. I'm glad I'm not in the city like Lindsey, but
hey, I asked for it. It's fine.
Yeah. No, you've lived there before, yeah. So I don't think there is any rhyme or reason to, at least that I know of, to getting a particular placement. Now I have friends that live in the area. They're like, I live 5 minutes from Hackensack Hospital. Like they're likely going to get Hackensack, but for somebody that's just moving up here, I don't think there's any way you can get priority at a place unless you have like family in the area or some reason. So don't feel like you have to take step early if you don't want to. That's not going to help you.
Yeah. Your priority is passing step on the first time around. If you guys haven't already taken it, priority is passing on the first time around. Literally nothing else matters for you in this moment in time, because you will get placement and it'll all work out. We had the exact same feelings. We had the exact same breakdowns, went through everything, but just focus on step if you haven't already taken it.
For sure. We talked about the resources. Again, UWorld's going to be your number one thing. And I'm telling you, these questions are different. Like, you know what's funny about the questions? Lindsay could probably attest to this. The answer's not like, they want you to put the step one answer, right? So they like, they'll give you a situation and they'll be like, oh, you know, this is asthma. But it's like, they know you're going to think that, and then they change it a little bit. So it's like, it's always the same. So doing questions is like super important because it's just different. It's kind of funky the way they do it, but you just have to get through it. It's kind of like when you went through UWorld the first time. It's very much a learning experience about how the questions are organized, right? Not just the material, but how you're actually going to approach answering it. Let's see.
So how early do we need to schedule a shelf for the rotation? So the first or second week of your rotation, you're going to get an email that you have your scheduling permit. And at that point, you can go schedule your shelf. We don't pay for shelves. So you're not going to have to pay anything up front there. You usually try to schedule it for like the weekend at the end of your rotation. Sometimes, depending on where you are, testing centers, the dates and times might get a little few and far between. Like, for example, for my FM rotation, some people are taking on the 16th and our rotation doesn't end until like the 22nd. But it's just because the location of where they don't have anything past that. And I have to drive to New Jersey to take mine, and I'm taking it on the 20th or 21st. So as soon as you get your scheduling permit, go on and see the times and the dates. And then you can go and you can reschedule it. For shelf, I think up until like a week before, it's free to reschedule. So it's not like step where it's, you know, $120 something to reschedule it within a certain amount of time frame. As long as you have a few days or a week, I think you can reschedule it without having to pay anything. I would schedule it for as late in the rotation as you want, because you want to do well on the shelf. And so last time I took it on the Saturday after the end of my rotation. This time I'm doing the same the Saturday after my rotation. So it's really how much time you want to study.
And it is a little different for the 6-week rotations. You're a bit more crammed study-wise. But for instance, for the 12-week rotation, since we've had a little bit more time to study, like we all did it strategically. Okay, so for the 6-week rotations, you get off the day before to take your steps. So, but for the 12-week rotations, you get off 2 days before. So my 12th week of the rotation, I scheduled it on Friday. Therefore, I get off Wednesday and Thursday, and then I'm off Friday to take the test, and then I have the weekend off before I start surgery. Okay, so basically my 12th week, I'm just going to the hospital Monday, Tuesday. I could study Wednesday, study Thursday, take the exam Friday. So do it strategically. If you're a little bit more cramped for time, you may want that Saturday or Sunday. I just figured I'd like the weekend before I start the surgery rotation. Let me reiterate, the second you get that email to schedule your shelf, go find a spot in the hospital quietly or whatever, walk away and go schedule it immediately, because the last thing you want to do is have to find a place or go a day you didn't want to go. And so as soon as you get the email, just book it. Like Lindsay said, you can reschedule it, but just have a thought like when I want to take it. And then, you know, you should get that email about 2 weeks prior, and then you can, but yeah, but book it immediately, because you don't know. It's kind of like step, like the seats fill up. So you need to book it as soon as possible. Okay. Any other questions? Living stuff? I don't know. Any other life issues? Anybody?
I brought my car.
Go for it.
I was going to say, I brought my car in New York City. So just to let y'all know.
Okay, so just like want to clarify on the scheduling, how Lindsay, you said you scheduled it that Saturday. So I'm starting with surgery, and the dates SU gave me says I'm starting August 15th, and then it ends November 4th, which is a Friday. So you're saying to take it that Saturday, the 5th, or do we have to take it before the 4th?
Your scheduling permit will include the weekend after that Friday.
Okay.
So
Okay.
if you want to wait until that Friday, Saturday, Sunday, you can absolutely do that.
Okay, perfect. I just wanted to
But-
make sure if we had to take it before the 4th or
Mhm.
yeah,
Yeah.
that week.
But because it's a 12-week module, like you'll probably be ready for the exam. So you could do like I did, book it on that Friday, and they'll give you off Wednesday, Thursday to
Okay.
study. So
Right.
then you can have that weekend off, or you know what I mean? Because if you take it Saturday, then you have to show up to work on Wednesday. Take it on Sunday, you don't. So like if you get those 2 days off anyway.
Perfect, because I have a
kind of
wedding
thing.
that Saturday and I was playing it by ear to see like if I can go or not. So that's perfect.
Yeah.
I mean, technically you could take it earlier even. You could take it,
Yeah.
I have friends taking it for Thursday, but then they have to show up on Friday to work.
Yeah.
So,
See.
you know,
Okay.
that's what it is, yeah.
Yeah, just do what's best for you. Honestly, some people take it a week early or something because they're just ready and they want to get it over with. Some people wait until the last day. And so it's really just up to you. Decide what, you know, you're scheduled to decide what's best for you. But yeah, your clinical director for that rotation, they will probably ask for the confirmation. And that confirmation kind of gives you that day and the day before, like the 12-week ones, the 2 days before. And that's how you can say, okay, these days I need off. And for us, we don't have to reschedule those days. Like those are
No.
yours. Like they get
Right.
essentially taken out of your requirement of the rotation. So,
Okay.
oh, and
perfect.
for our peds rotation too, sick, it was different. It was okay, now I can't even remember because there are sick days and there are personal days. If I remember correctly, we didn't have to make up sick days, but we did have to make up personal days, and you got a certain amount of time for each. So, but like Brady said, it's really dependent on the rotation. And so just make sure you're in contact with that person because they're going to be the ones that actually give you your grade at the end. Everything is turned into them. And so just make sure that you know what their expectation for you is.
And everybody gets sick in peds, right? Everybody gets URI for respiratory.
I was so surprised. I thought those kids were going to make me sick. I was doing a PCR on a kid. Oh no, I was doing a rapid on a kid and he coughed in my face when I was doing the swab. I was like, oh God, it's over with. I'm done for. But it turned out negative and I didn't get sick in the peds rotation, but I swore I was going to get sick from those kids.
Yeah, they're little petri dishes.
They really are.
How long does it take for shelf? You should get your shelf
Like a
scores within
week.
a few. Okay, I've heard anywhere from a few days to a few weeks.
Yeah.
But
They show
generally,
up they show up on your student account. So the self-service thing, they show up there. You go to, and you have to go to documents or something along those lines. And then it's just like this plain text box and you have to click on the PDF of your score report and it's there.
I didn't realize that. Okay. And then how long after you got your shelf score did you get your
A
final?
while. I haven't even gotten no one that I know, like Madison started beginning of May. She still hasn't gotten her OB-GYN score. And so it takes a while to get your final score for the overall rotation because it's one person going through everything, going through the evaluations. And this person is also, you know, an MD practicing. And so it takes a while.
Yeah, there's a lot of paperwork they have to thumb through to do all of that. But look, my guy said, oh, sorry, the attending said that the course director said that our shelf exam is going to play a large part into where we fall because they don't have a lot unless you're attending when you're doing rounds. Like they don't have a lot of interaction with you. Just like if you talk up and during lecture and stuff. So like what the residents have to say about you, the comments they leave in your observations, those are going to matter. They even say when they give your grade, like when they put on your score, it's not a score report, but your grade report that they submit, they can put things in there like resident said he was a good team player or whatever, right? So it does take a while to get through, but like that shelf score is going to matter. Like if you don't think that, you know, just know that that factors into their thought process too. Like if this kid's an honor student, like he or she is expecting to honor the course too. So because like I said, most of us are going to fall into we're good team players. We're willing to work. We're willing to help. Like everybody's kind of in that category.
Yeah.
So the only thing really separating us out is our board or shelf
Yeah.
scores.
And that's why that is the single most important thing. Like, show up, do what you got to do. If there is an interesting case, like for example, there was a paracentesis and it was 3 o'clock and we were usually gone by then, but there was a paracentesis. And of course, all of us wanted to stay because we'd never seen one before. And so we were there until about 6 or 7. Because, you know, you prep it and then, you know, we were helping run labs and we had to go get the forms for the cytology. So there was a lot of like busy work for us students in there, but, you know, we were there really late in the day. And like, that's an example of, you know, staying and experiencing and helping out the residents, and the residents really appreciate it. But like we've both said, we cannot stress this enough. If they release you early and there's nothing going on, go and don't feel guilty about it. Like, go get your studying in, go take a nap. Sometimes you come home at the end of the day and you cannot keep your eyes open. Like, you want to be productive, you want to study, but you just physically can't. And so that's also, you know, you'll make a schedule and then it won't happen.
So don't feel bad about that either, right?
Yeah.
Like, some days I get home with intentions of doing something and I lay in bed and stare at the ceiling for hours. So it's fine. Like, it's okay. You'll be okay. You'll be fine. You know, just don't burn out, right? Like, this is a long road. These are long, you know, don't feel like, you know, you can cover this material in 12 weeks. IM is probably the most dense shelf exam. You can easily cover it in 12 weeks. Okay. So don't feel like, you could do a little bit each day. Don't feel like, you know, if you have a rough day, just, it's fine. It's going to happen. Any other questions you guys have?
I do have a question. So how does the picking the site for rotation works for couples, especially if like my spouse is in another school in the US and we don't have any common site? So how does that work?
You have the opportunity when you make your selections or you make your preferences to type in a comment box to say anything that you want them to know when they place you. So if your spouse, if there's an area that they're close to, I would maybe say, hey, my spouse is going to be rotating here. I would like to be close to them, and they'll try to accommodate you as best as they can. But yeah, that's what I would do in that case.
And I know people have stories, you know, that they didn't get their first spot, but for people in situations where it matters like that, like, they've been very accommodating. Like, we have friends up here that are married with kids. Like, yeah, they're going to put them in a hospital there. So if you have a spouse or significant other, like, they'll make accommodations. But like, if you don't have any ties, like, you know, they could kind of put you where they want you. So, you know, that's kind of how it is. Anything else? Y'all are going to enjoy it. It's definitely a change of pace. It's really interesting when you've like learned about these things and you kind of see it in practice and you're like, oh, okay, yeah, like it kind of makes sense. Like, the first time you hear a barking cough, you're like, that definitely sounds like a dog. You know what I mean? Or like, then I'll have to disappoint y'all. I haven't seen Marfan syndrome or pheochromocytoma yet, though I know everything about it. But
I've seen so much sickle cell, much sickle cell.
Sure.
Like, I know everything about HBSS at this point.
So yeah, things will be common. COPD, yeah, kidney disease, kidney injury, cirrhosis,
like
sadly, yeah.
A laundry list, like they'll have hypertension, hyperlipidemia,
diabetes,
end-stage renal disease on hemodialysis. Like, a lot of your patients, especially inpatient, are going to have a laundry list of things. And then like history of cancer, history of, like, there's so many things that are being managed in the hospital other than just the chief complaint, because you have to make sure, okay, they have hypertension at baseline. Okay, what do I need to, how do I manage their chronic hypertension in the hospital? How do I manage their chronic diabetes in the hospital? So you're not just treating their chief complaint, you're treating every single comorbidity that they have and how it can affect the chief complaint that they came in for.
And look, so it's a great opportunity because you're going to have more time than the residents and the attendings to talk to these patients, and like, just pull up a chair and just talk to them. Like, you'd be surprised how much they'll tell you that they won't tell the residents. Like why is there so much fluid in their lungs? Nobody could figure out. Come to find out, they told you that they stopped taking their furosemide or Lasix. You know what I mean? Like, and that matters. So like, like I've said this before, like none of these patients care about how many diplomas you have on your wall. They really just want a friend to talk to. So at the end of the day, that's you, and that's a great opportunity and a great thing that
Oh, yeah.
you worked really hard to get to this position, and now it's gonna pay off in ways that you really can appreciate when you just talking to another person and you're like,
Yeah.
it's not a book, it's not a picture anymore, it's tangible that the person's there in front of you, so it matters.
Well, and a
sorry,
lot
go
of
ahead.
these patients too, especially inpatient, they've been there for a while. They're tired, they're frustrated, they're getting labs drawn every single day to trend their CBCs, and they are aggravated. And if you take the time to go in and just talk to the patients, you will be amazed at how much their attitude changes, how much their just entire being there changes. Like, don't hesitate to go in, advocate for your patients, talk to your patients. Like, it's so cool when you get in there and you're actually hearing people's experiences with these things that we've been studying for the last 2 years. It's very humbling. It is
It is.
extremely humbling when you round on a patient and we went in and this patient's hemoglobin was below 7, and the convention is below 7 you do a transfusion, but we wanted to make sure, but it had dropped kind of rapidly, and we wanted to make sure that it was real or not, because sometimes labs come back and there's something wrong and it's not a true value. And we told her, we're going to do another CBC, and she said no. Just she was tired. She was tired of being there. She was tired of being stuck, and she said no. I'm not going to do it. And then everyone, was talking over each other, trying to explain why, it should be done. She's like, no, let me talk. And, she kind of relates how frustrated she is. And then, a couple people went back afterwards and spent an hour just talking to her. And, all of these patients are reasonable people, sit down and talk to them. And it's so humbling to hear their experiences and what they've been going through and how frustrating it is, being sick and feeling like crap and being impatient. And so, you get a lot out of it. You get a lot out of it.
It's a very lonely experience being in that hospital, but these patients have been in there, like Lindsey said, for weeks at a time, and they don't know what's going on. It's like, but so if y'all have a few weeks before you, one of the best books I've ever read is Quantum Healing by Deepak Chopra. It goes into the idea of what is a patient's mindset towards their treatment? Like, if they have a positive attitude towards treatment, how does that affect them, right? If they go into it, I mean, we know like things like cortisol and stress, but like, how does it go into it if a patient is positive towards their treatment? And then he goes into, well, what if the doctor's positive towards their treatment? Are they going to be more compliant? So things like that. So maybe not just pushing pills like we do in Western medicine, but the idea of approaching it from a human mindset, right? So if y'all have time, that's a good one. Other than that, anything you should do but start to prepare, just kind of have an outline of what you are supposed to be doing. Like, okay, I'm going to do my firecrackers weekly. I plan to do this many UWorld questions a week or whatever. I'm going to do my PELs. I'm going to get my direct observations, know where you need to be, where you're supposed to park, these little things, the transit time, plan for traffic, especially if you're up in the Northeast. Other than that, I mean, I'll just have a few weeks. I mean, I don't know that you really need to start studying. Maybe, just kind of, you're going to study a lot. So just make sure you're prepared. You have all the orientation stuff done. You know where the hospital is. You know where to report. Get moved up here or wherever you're going. Be sure, everything's, if anything, get all the logistics behind your living logistics done. That way, when you start in the hospital, you don't have to worry about it. My furniture from New Orleans took about 6 weeks to get here. I was on an air mattress for 6 weeks and a whole bus. It was just a joke, but that's another story. But yeah, so maybe try to get all the other stuff done, know where the grocery store is, all that stuff. That way, when you start, you can focus on school, so pretty self-explanatory, but Any other questions? You can always reach out to Lindsey and I. We're pretty good about getting back to
Yeah.
y'all. So anything else?
Have fun, guys. Like seriously, being a clinical student is so great. You really feel like you're doing what you want to be doing. It's really great. Have fun.
Yeah,
Thank you guys
for
so
sure.
much for doing this. We all really appreciate it.
No worries.
Yeah,
It's
of
all good.
course.
You staying in California, Tom?
He's res-
Yeah.
Yeah.
I mean, I want to practice out here, and
Yeah.
from what I understand, if you don't rotate out here, it's hard to match here. I mean, I'm not going to get UCSF. Nobody does. You got to have pedigree for days if you want to work
Yeah.
there. That's
Pedigree for days.
You do. I mean,
I believe you.
It's the
I believe
NFL.
you 100%.
Everybody there is
Yeah.
a rock star. So
Yeah.
you got to
Understandable.
live a life in medicine before you can get a job there. But you got to start somewhere.
It's all good. Yep. Yeah. So, and if any of y'all are coming up to New York, New Jersey, I don't know that we haven't learned the ropes exactly. At least I haven't. But there's still some places around Hackensack Hospital where I live available. So, if nothing else, we'll go ahead and stop the recording. Again, if you guys need anything, as always, you can reach out. Lindsey and I will post this later on. So good luck with everything. Enjoy your last few weeks, and we'll talk to y'all later.
Yeah.
Bye, guys.
Bye.